Is your back bothering you right now? Your lower back just pulling, even while you're sitting? Or have you ever thrown out your whole back where every single step is a challenge? It's excruciating. I've been there. A lot of surgeons are hunched over. A lot of people at their offices are hunched over, driving around, right? Half of Americans report having back pain each year. 16 million adults suffer from chronic back pain. 16 million. But here's some good news. Every year we are one step closer to the solution. Today we're bringing you some of the biggest medical advances to treat your chronic back pain. Joining me down to help dive deeper into this understanding of new innovative ways to tackle back pain, our husband and wife chiropractic team, Dr. Michael and Lori Smath. They've been huge supporters of HealthCore, our kids' foundation, for years. So I love their spirit, but I especially appreciate what they know about their specialty. And I'll start with Lori, because chiropractic offerings have been around for 100 years. They're still one of the leading treatments for back pain. Why?
Because it works. The body is a self-healing organism, and chiropractors look for the cause of the problem instead of just simply treating the pain. So we analyze the spine. We find the areas. Usually what we find is that a few of the vertebrae or more are rotated on themselves, causing a pressure on the nerve, and that pressure stops the body from healing itself. So what we do is we find the area and we adjust it. It's a subluxation. We put it back into lux, and then the body can heal itself.
I experienced this firsthand where I was having horrible pain before a meeting, and Michael saw me hobbling in. Yeah. He took me back to my own office on the couch, did one manipulation, and it made a dramatic difference. Yeah. And I only point it out because I think when you have back pain, one thing you don't want is surgery. You should be trying lots of things along the way, and intervening and with techniques that we're going to talk about today could make sense. So our first breakthrough is something you can do right now at home. It's a new device to help you stretch your lower back. You know what lumbar support looks like? Well, we got a new device that makes it even easier. Jen is demonstrating right now. By the way, it looks like this, right? So it's arched behind your back. So describe it. How does it feel?
Feels like it's letting the pressure of my lower back go.
It's the opposite of what we do all day long, right? Normally we're hunched over. This actually purposely stretches it out. I like the little bumps on it as well. And I like that it's a simple thing. You can put a pillow behind your back as well, or something that has some substance to it if you desire. But I wanted to understand why this idea works. Because when I drive in a car, I have a lumbar support. So what is it, Dr. Smath? What does it do, and why does it make sense?
Absolutely. So what happens is, from hunching over all day, we're on the cell phones, we're on the computers, and this is a normal curve of the lumbar spine. This is a side view. So what happens is that from going forward, we're constantly putting pressure on the disc.
There.
Yeah.
See, you can see it being squeezed.
Exactly. And over time, these vertebrae start rotating and actually press on the nerve endings. So now this nerve, let's say the sciatic nerve, is going to start to diminish in function. You're going to get pain, muscle spasm, loss of range of motion.
Does this do?
So this apparatus, you lie on it, and you're actually bringing back the spine to its natural curve, and you see how those disc spaces are opening?
Yep.
Yeah. So what that does is, actually, this kind of motion also rehydrates the disc. So it's like throwing a dry sponge into a bucket of water, and it expands. So that's a beautiful thing with this exercise. And, in the past, we would give our patients exercises to do at home. But when you have a gadget like this, you see it in your bedroom, in your office, and, it reminds you, hey, I better do this exercise.
By the way, this device has 3 different levels. You can work your way up in intensity, or just do what I do, just put a pillow behind my back if I'm watching television or sitting in a car. It just elevates your pelvis forward and does exactly what Dr. Smath described. Okay, so our next breakthrough in treating chronic back pain is through a new surgical innovation. It's an implantable device called Reactivate. Here with us to explain this new device is the University of Colorado Executive Vice Chair, Orthopedic Surgery, Dr. Vic Patel. Dr. Patel, who's the ideal patient for this implantation device?
This device is designed really for patients with chronic pain and not acute pain. Remember, acute pain is pain that's caused by injury or damage to the body. But that acute pain can turn into chronic pain when it leads to muscle inhibition, and that muscle inhibition leads to instability of the spine. And that instability of the spine can then lead to this vicious cycle of pain, muscle inhibition, and more instability. Reactivate is designed for those patients that really don't have a surgical treatment or fix for their pain. And they're patients where intensive rehab still doesn't work because they can't consciously rebuild the multifidus muscle. Those are the patients who end up on chronic pain medications and no good solutions or answers for their pain.
So I've always wondered when someone would come up with a better idea that doesn't involve cutting open your back and trying to fix something that's not so easy to fix. So let's take a deeper look into how the body reacts to the implant. So this is actually an image of the device. It's a wire, right? And the wire has little electrodes, and it's placed next to specific nerves outside the spinal canal to stimulate, to stabilize the muscles. These muscles are there to protect you. Right? Those muscles actually, when this electrode is placed next to them, are gently stimulated. That causes the nerves that control the muscle contractions to start activating, as you see there. Right? The brain senses these muscle contractions, and in response can trigger restoration of muscle control. So you're actually building up these muscles again, and these muscles provide the joint stability, so the chronic pain cycle is interrupted and ultimately may relieve pain. Now, Dr. Patel, you work with the company to teach this procedure to other physicians. They know how to implant these electrodes. Is reactivate something patients keep forever? Does it need to be removed eventually? Give us some insights.
Sure. Reactivate, again, works differently from other stimulation devices because it's there to rebuild the muscles. It's a more natural way to rebuild the muscle stability of the spine. Generally, it works over the course of about the first 3 months when patients really start to feel improvement and feel like their spines are stronger and more stable. They might continue to improve for a year or more, and the device can be taken out at any time. But really, my patients haven't wanted it taken out because it almost feels like a security blanket that they can use it whenever they need to, and they really never want to go back to that old chronic pain that they had.
Well, just about anything's better than opiates. Thank you very much, and kudos on your advances. Okay, the next big advance in treating your back pain at home is something that's very, very simple. It is a pelvic clock. See? It's basically a half-circle device, and it's got a little clock on the back. So what is a pelvic clock, and how do you use it?
A pelvic clock is designed to create mobility in the areas of the body that can become imbalanced. So if you are repetitively moving with imbalances, you will eventually get pain. So there's certain ways that the pelvis can move and become imbalanced, and it's tilting forward and sideward and leaning to one side.
Like you're dancing.
So yeah, exactly. So the pelvic clock helps stretch the muscles and reduce muscle spasm. You do have to, consult your health professional, first before you do something.
You want to know what's wrong with your back before you play around with it.
Right.
I've got Jen here. You're going to demonstrate this for us. So again, it goes under the pelvis, actually the sacrum area. Mm-hmm. So I'll just put it, actually, it goes like that. Is that about right? See if that fits you. Mm-hmm. It should be comfortable. Mm-hmm. And then if you do this correctly, you're going to be lying with your knees bent with that device, the clock, right beneath the middle of your back. Then you're going to gently rotate 3 o'clock to 9 o'clock. That's why it's a clock, right? You want your spine to be alive, but you don't want to stick your belly up on purpose. You want to naturally just relax on this device. And then you go back and forth, rocking from 3 o'clock to 9 o'clock. Do it 10 to 20 times. So what do you think? You think you could salsa a little better with the hips loosened?
I think so.
Is it uncomfortable?
No, it's very comfortable. I sit all day. As a psychotherapist, I'm sitting all day in front of a Zoom call. So this feels like relief.
All right. If you suffer from chronic pain, you may have been told that it was all in your head. But what if it was possible to use your brain to heal your pain? Find out how when we come back. We are bringing you the most recent scientific advancements in the search to end chronic back pain. And the latest comes from a breaking news study that says the answer may lie in retraining your brain to how it perceives pain. Now, here to help us understand the latest development and how brain therapy might be the next best solution to ending your back pain is psychotherapist and author of The Way Out, Alan Gordon. So Alan says that the brain can perceive pain even if there's no physical reason you should be in pain. So how does that work?
So pain is a danger signal. If you put your hand on a hot stove, the pain is letting you know that you need to move your hand so you don't cause more damage. But sometimes the brain can make a mistake and actually interpret danger where there is none. And we can feel pain even when there's nothing wrong with our bodies. It's a false alarm. And the pain is 100% real in these instances, but is being caused by the brain and not the body. And more studies are actually finding that with many forms of chronic pain, this is what's going on.
So what is pain reprocessing therapy, and why is it such a breakthrough in the field of pain?
It's a set of techniques that teaches the brain to turn off that false alarm. So essentially what's happening is the body is sending these normal, safe signals to the brain, but the brain is misinterpreting them as dangerous and generating pain. So pain reprocessing therapy teaches the brain to interpret these signals correctly, which turns off the pain. We actually just did a big study on pain reprocessing therapy and found that 98% of the patients improved, and amazingly 66% of them ended up being pain-free or nearly pain-free. And the really exciting thing about this is that chronic pain is generally considered to be irreversible. But what the study shows is that most people with chronic pain can get better.
Hallelujah. Now, you got a video of this technique helping a patient get almost pain-free in under 15 minutes. They've been suffering in pain for 30 years.
The back pain is going to come up just because, you know,
It already has.
It already has. Great. All right, we want it to, because this is an opportunity. So all we want you to do right now is see if you can just kind of practice paying attention to the physical sensation in your back. You're only going to be doing this for about 20 or 30 seconds. And see if you can actually enjoy paying attention to this nice gentle stretch in your back that you haven't used for a long time. Isn't it a nice and
I get excited about standing.
Yeah.
That's just goofy. You know what I'm saying?
Yeah.
You can be excited about standing. Hey, I'm standing. You know?
I know. And what do you feel in your back?
It just feels interesting. Is the first word that comes to my mind, but
Yeah.
that's not descriptive. It feels like it's growing. It feels like it's stretching in a good way.
Yeah.
Expanding.
And what's the level of sharp pain?
None.
You've been standing for 3 straight minutes without moving, and you have no pain in your back.
Isn't that amazing?
So Greg is joining us via Zoom. I got to say, it was emotional just watching you go from discomfort to not. What was it like living through chronic pain for so many years?
Well, honestly, I'd lost hope. 30 years was a long time to be in constant pain. You know, I first hurt my back lifting weights and playing football in high school and college, and yet eventually I stopped being active because everything I did, it all hurt. I had a lot of teammates who had multiple back surgeries and with limited success, and that was something I didn't want to do, and I wasn't going to medicate my way through life, so I just did the best I could to deal with it. Yet the constant pain had changed who I was and how I interacted with people, and not in a good way. So, and even several years ago, I woke up one morning essentially paralyzed. I couldn't move. And 3 different doctors told me that surgery to fuse my back was my only option. Yeah, I'd lost hope.
Yeah, that's when you know you're really at your rock bottom. So how is the pain now after the study?
Well, I have my life back, literally. I live back pain free without surgery and without medication. I mean, I still get sensations in my back, but through the study, Alan had helped me reframe what those sensations were. They're not pain. They're just sensations, kind of like the sensation I'm feeling right now sitting in this chair. I mean, I feel the chair, yet it's not a sensation of pain. And so now I can do all sorts of things that I couldn't do for years. I can exercise, I can walk, I can hike, I can bike, I can ride my motorcycle long distances. I have my life back.
I'm so happy you're doing better. And here to bring these techniques into our home is someone who's actually had her own struggles with back pain. They're constantly sitting at a desk for work as a licensed therapist and lifestyle expert on this show, Tia Brown. The therapy appears to be an incredible breakthrough, but we all want to know how do we actually apply this to our lives at home. So first you say, we got to figure out, is our pain truly brain generated? So is it from our brain or something wrong in our back?
Absolutely. Even though it's called brain pain, it doesn't mean that it isn't real. It is real. It's our mind triggering us saying that there's danger where it shouldn't be. So the way that we assess whether it's brain pain or structural pain is that we kind of want to look at 3 different areas. Number 1, when the pain started, did stress play a major role in its onset? We know that when we are under stressful situations, we get tense, our body gets anxious, and it can also trigger pain. Number 2, is the pain inconsistent? So is it a 2 some days, an 8 on a scale from 1 to 10 the others? We know that a structural pain tends to be, again, more consistent. And the 3rd is, does it move around? Yeah. Is it in your left leg one day, your right leg the other? These are all indicators that it's actually brain pain.
So you say we have to describe the pain. And most of the time when I have pain, I don't want to talk about the pain. It makes it worse. Why does it help to describe the pain in detail?
No, you're absolutely right. When we are in pain, we don't only not want to talk about it, we don't want to feel it. Yeah. So what do? We pull away. We're fearful. We don't want to think about it. But the best way to cope is to actually lean in a little bit and start thinking about the pain, right? So we want to describe it. Is it pulsating? Is it sharp? Is it tight? We want to do an assessment. Is it burning? Is it tingling? And what does that do? That gives us a little bit more power, right? And we're starting to realize that, you know what? We're okay. We're not in danger. These sensations are uncomfortable, but they're safe. And the more we tell ourselves that, the more our bodies relax. And guess what happens? The pain starts to dissipate.
So we just witnessed remarkable success, and I know that not everybody had this result, but enough people did that the paper's making some noise, this study. But we don't want it to come back.
Absolutely.
So how do you make sure that once you've described it and once you process, that it's actually in your brain, that you can manage it, compartmentalize it, and not have it return in a couple of weeks?
So this is the really challenging part, right? We need to embrace good sensations. Now, when we are in pain, again, our body tenses up and we're always scared that any sensation that we feel is going to lead to pain. But imagine if we really connected our thoughts to positive, good feelings, right? The way we feel when we hug someone, the way we feel when we watch our favorite movie, when we're walking in the park and the sun is on our skin. We want to hyper focus on good sensations. And when that pain kicks in, that anxiety kicks in, we redirect our energy to focus there.
Did it work for you? Are you pain-free?
Absolutely. I'm doing better.
All right, you're standing tall now. The road has been long for those who continue to suffer with chronic pain. I get it, right? Over 100 million of you. But today, we are one step further towards a solution. Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.